Good afternoon, everybody. Thank you for being here. I'll go through COVID data and then take a couple questions. Good news over the weekend, just a reminder, we're doing reporting from Saturday and Sunday on hospitalizations on Mondays. So obviously loss of life is included in that reporting. So we had nobody lost their lives over the weekend directly related to COVID, so no new deaths there. That's good. We've lost 694 residents to the pandemic since last March 16th. Our 7-day rolling average is stabilizing between 1.4 and 1.5%. We were lower. We had an uptick of cases related to younger adults. Certainly spring break, Easter, all these things led to a little uptick, but it looks like we're stabilizing and starting to go in the right direction. Positive cases, we transferred out, we transferred out 4 cases from over the weekend, so I think I reported 106 cases on Saturday, 100 cases yesterday. It was actually 105 cases Saturday and 97 yesterday. So for those who are keeping score at home with the accurate case numbers, we'll adjust those. But positive cases to date, 34,579. That's 57 new cases. We have 712 active cases, so that active case number went down quite a bit. And then hospital numbers went up, but we'll see how they do on discharges. Usually today it's slow discharging over the weekend, so we'll see what tomorrow's number will probably be a little more meaningful. But 43 residents in the hospital this morning, 6 in the ICU. So please keep those, especially those 6 residents, in your thoughts and prayers so they can get well and get home. Related to the vaccine, I think we'll have a full week of vaccinating here under this model, but we'll start to transition to more of a community-based model, getting out into the public with various clinics targeting various neighborhoods and various groups that have newly become eligible. So when we first doses today, we're still doing doses here today. We're doing a lot of second doses throughout the week. But when we look at our next major clinic for first doses, will be next Monday on April 19th. That will be a Moderna clinic. When we look at, we have 2 pop-ups scheduled this week. One on Wednesday at the Syracuse Housing Authority Freedom Commons building. And then we have our first pop-up clinic at a high school on Thursday, the Baldwinsville School District. One may ask, how did we pick the first high school pop-up clinic? We did a survey to the schools, then to the parents, and the best response with most number of kids that wanted to get the shot, that's how we determined where we would go first. We will team up with other schools that as well. You will see schools probably work together, where you'll see 3 or 4 smaller schools in the same area potentially have a clinic at one of the buildings, and we'll work on transportation. But we have held up some of our Pfizer vaccine to go do these 16 and 17-year-olds. The J&J vaccine, we're still working with our colleges to continue to support Syracuse University in their vaccination efforts. ESF Lemoyne will be working with OCC. The Pfizer and the J&J for the upcoming week are not widely available, so Moderna is what everybody is getting. So again, we'll do Moderna clinics, and then next week the pop-up clinics will most likely be Moderna. Remember, vaccine week, even though today's Monday, we're still in last week's vaccine week. The new vaccination week schedule really starts Wednesday. So on the vaccination front, we're as soon as everybody, so you give out shots every day, and then you need to go register these shots into a state system called NICES. Everybody does that gives out shots, so there's always a lag a lag time, so people get caught up. The likelihood is this week will be well over 200,000 first shots, which gets the adult population over, over 55%, going towards 60%. So we're, closely getting to the point where once we get through 16 and 17-year-olds, 18-year-olds, the younger demographics that became eligible, maybe another week or so here, where we'll have to really start getting proactive and going. It's going to get harder, but we knew this would come, and it's a good problem to have. We got to get to that 70%, 75% threshold. Reminding on testing. So this morning, a couple people told me, and we fixed the problem, but the community testing sites, the link was down for a minute this morning, and we fixed it. But we do have community testing sites. Today we were at East Syracuse Village Hall. Tuesday or tomorrow, yes, tomorrow is Tuesday. We'll be at the Northeast Community Center. Wednesday, we will be at the Skinny Atlas School District office. Thursday, Onondaga Town Hall and Shove Park. And Friday, we will be at the Town of Clay Senior Center and Fayetteville Village Hall. A reminder on symptomatic testing, Monday through Friday, 9 to 1. You can register on our website to go to the FSHED. Right now, where the risk is, it's probably symptomatic spread. I think in a couple of weeks we'll see the caseloads in the younger demographics start to really be under control again, and then it's just vaccinating so we can end this thing. One thing that working with some of our faith leaders in the Muslim community, today begins Ramadan. And I just wanted to wish all of our Muslim neighbors a blessed and peaceful Ramadan beginning tonight at sundown. I know last year was challenging and mosques were closed, but now we are beginning to reopen, and there will be space to worship at mosques this year. Please know that you're not breaking your fast by getting the COVID vaccine during Ramadan as well, and especially to our younger generation of Muslims observing fasting for their first time. I just want to wish you encouragement to be strong and disciplined on your journey, and happy Ramadan. Happy to take questions on these topics or others.
Can you kind of run us through the logistics of, setting up a vaccine clinic at a high school, like what's happening at Baldwinsville on Thursday?
Yeah, so what will happen is our emergency management team, our health department will go. These will most likely be in gyms, so similar to boys and girls clubs. And then same thing, they're getting good at this, right? So, you work through the logistics, your vaccination tables, your waiting areas, your assembly line. And again, the school districts work with us on getting parental consent or guardian consent. And so we'll hopefully get 250 kids on Thursday, maybe more. But that's the goal. Then we'll go, the other bigger, larger school districts, again, if you want to try to, if you're going to be out, try to get to 200 to 300 shots. That way you're utilizing your infrastructure the best way. And I think there's some other districts that we could probably get close to that, and we'll go and do that. And then some of the smaller ones we'll team up. And then if there's transportation needs, we'll work with them on that.
Can you kind of explain the threshold of interest? You mentioned that Baldwinsville had the best survey response and interest from students. So can you kind of explain how that's going to work for the other school districts moving forward?
Yeah, so again, the easiest one, it's about shots in arms, right? So the most parents that responded, they were going to allow their kids was the Baldwinsville School District. So they go first then, because that's the best use of our infrastructure. And so there's other districts, the other large ones, obviously, you have more kids to pull from, but some of the smaller ones we're pulling together. And then there's some mid-sized districts, too, that actually percentage-wise are doing very well. They just don't have as many kids as the large ones. So we expect the next 2 weeks we'll be flying all over to the various high schools to get this done. And there is more. Your doctor's offices right now don't have Pfizer. So if parents are saying, want to wait for my doctor's office. That probably isn't going to happen because they get the Moderna. It's an easier vaccine to handle. So that's certainly parents can talk to their doctors about the safety of the vaccine, but they probably physically won't have the Pfizer vaccine. And the Pfizer vaccine for 12 to 15-year-olds they did ask the FDA for emergency authorization. I believe the FDA will probably meet later this month. So again, that will be the vaccine that will be used for that age demographic as well.
So is the county providing all of the assistance and resources for these clinics, or are the schools required to bring anything to the
No,
table?
this is our team's going out there. Yeah.
How do people sign up for appointments at pop-up clinics?
So what we will do, Tim, each time you do, there's various types of pop-ups. Sometimes you work with credible messengers in the community, and they work with our team for registration. Sometimes you do pre-registration with credible messengers, then you just allow walk-ins. Sometimes in these cases, we're probably not going to have any walk-ins. These will be students, right? So we're not going to have we have a limited number of Pfizer vaccine until we get more. So we're not going to, we have Moderna for anybody 18 and older, or Johnson & Johnson. So we're not going to use the Pfizer on somebody that could get the Moderna or Johnson & Johnson now. So, but where we're going to be is we're going to start hitting up different zip codes that we haven't been in yet, that the numbers are lagging a little bit. We'll be in some rural communities. We'll be in more urban communities. And then we'll probably utilize reverse 911 to say we're going to be in your neighborhood. Please go to this link, register, call this number. We can pre-register you. But we probably will allow walk-ups at this point as well.
Are they registering on the county website?
Yes. Yes.
Regarding the vaccine, you mentioned last week that Syracuse University did a mass vaccination clinic, and Syracuse University is also mandating all their students to be vaccinated by the time next fall semester rolls around. What do you think is a good idea?
Well, I think it's their choice, right? So I'm not going to, I believe, okay, so Ryan McMahon believes in the vaccine. I got a shot, I got a second shot. I encourage everybody to get the vaccine. Do I believe in mandates of the vaccine? No, I don't, but I'm not going to second guess. They're a private institution, that's their call. We'll work with so right now we're going to give them more supply. We haven't edged in stone a mass vaccination day yet because they're still trying to get a grasp on how many students would show up, right? So again, when I talk about infrastructure, I'm talking about the number of people we're paying to go do this. And right now we're always, second shots are flying. So we always are doing second shots here and then everywhere else. So you don't want to break up that infrastructure unless you can get at least a certain number of doses, first doses. So I think that right now with SU, we're going to keep supplying them supply, figure out how many students are there that still need the shot, that are willing to get it now. I believe the mandate is for next semester. And so, again, we would love to go up and shoot up, thousands of arms on the campus if that's what we can do. It's all about shots and arms at this point. So but we haven't finalized any of those plans yet, though.
Do you know how many college students are vaccinated?
Yeah, I saw the chancellor, I think, was on a news outlet. He thought there's 4,000 students. My guess is there's probably more, but it's very hard. The data. So again, the data. It's tough on the data because there's so many different points of distribution now. You can go to drugstores, you can go to Wegmans, you can go fairgrounds, you go here. You have the pop-ups, and it all gets input into the system at different times. So there's really a lag on that on the statewide data, and so it's tough to figure out. You can do some surgical efforts, and then it may take a while to show in the system. So I'm not quite sure how many total students. I know we're up at Lemoyne. I think Lemoyne's campus is pretty much done, smaller campus. My understanding is ESF is pretty much done. There might have been a handful of students that they've identified that we'll either send to SU or we'll get them vaccinated one way or the other. We're working with OCC next week, but I still think that if there was a campus left, I still think we have more room to grow at Syracuse, right? There's more kids. So I'm hopeful we can identify more students and we can get them their vaccine.
Are you planning any more drive-through clinics as a way to attract
Yeah,
people?
when weather works, right? So the problem is you can't, when the weather's not cooperating, having 40, 50 people sitting out in the rain, I'm an employer that presents workforce issues for me. If the weather cooperates, I think the drive-through is something that people liked for sure the first 2 times.
We had a viewer call asking for information about the mobile vaccine clinics for homebound residents. Can you just give us an update on the status of that?
Yeah, so what happens now if someone were to reach out to us, we then partner with Nescentia Health and we give them that information, and then they'll make plans to go and vaccinate that resident. So we gave them, I think this week we're giving them another 200 doses of Johnson & Johnson, and they'll go out and continue to kind of be our homebound partner. So if anybody has a relative or a loved one that wants the shot, they can send us an email and we will get them on the list and we'll get them out. I get those emails myself. They can email me personally.
Brian, you said that later this week we'll get to 200,000 first shots.
I think we're probably already there, Josh. It's just it hasn't updated yet.
Have you allowed your team, or maybe even your mind, to wander maybe 4 or 5 weeks from now to figure if we're going to be closer to that 70% mark, and what happens when we do hit that 70% mark?
Yeah, I think we keep going because as soon as the age groups open up, right, you're not at 70 anymore. It's going to be hard, though. So I think you're going to see a situation where you're doing pop-up clinics and your first goals are 250 to 350, and you're doing multiple pop-up clinics a day. Then eventually I think it's going to really slow down. I think when children, or when there's a vaccine ready for children, I think you'll see the main points of distribution be pediatricians. I think the 12 to 15-year-old demographic, I still think we can take a lead in that. But I think it changes a little bit after you're through that 12 to 15-year-old demographic. I think once you're talking about little ones, the doctors and the pediatricians need to be the focus of that distribution.
How many vaccine doses will be set aside at each of these, high school pop-up vaccine clinics? I imagine it varies depending on size of the district and other
Yeah.
things.
So again, this week, this Wednesday to Wednesday, we'll be doing Moderna. It will be the new vaccine we receive. We still have some Johnson & Johnson and some Pfizer. Next week, which would be not this, starting next Wednesday, not this upcoming Wednesday, we would like Pfizer. So we're asking for Pfizer so that anticipating that even potentially later that week, the FDA could turn on the 12 to 15 age group demographic for the Pfizer vaccine. So that's what we would like. We have the infrastructure to be able to handle Pfizer. Some other smaller governments don't. Doctors' offices don't. So we're a good outlet for Pfizer. Give us Johnson & Johnson too if you want. Moderna can go to the other distribution points because you don't need, it's a less complicated vaccine to actually administer.
So how many students will be vaccinated then on Thursday at the Baldwinsville clinic?
We're hoping 250. Again, there's going to need to be parental or guardian permission for that, but it looks like we could potentially get that high.
So you're going to do a mass clinic here next month, and then do you foresee kind of phasing out the on-center as a mass vaccination site?
We'll see. I'm concerned about demand, right? Being able to even meet it. We're going to give it a run on Monday to see where we are. We'll do up to 1,800 shots that day, but we've had the opportunity to have that kind of participation last week, and we weren't quite getting there. So we'll do that. We'll do that Monday, and then we could be looking at second shots here and 2 or 3 pop-up clinics throughout the community each day instead of this model.
And how how much longer do you foresee the county providing free testing?
I think we gotta, until we're through this, Tim, I think you need to. We need to encourage it. It's our way to, it's risk management, right? So it's our way to try to find this virus and box it in so it doesn't create other problems. Also, from the standpoint of data, it helps us make clear and coherent arguments about economic restrictions. So I think we'll continue to do it. There will be pressures that I don't think the marketplace is ready to meet, and I don't think it's been well thought out related to when we get into wedding season. I don't know if we'll be able to meet that demand for free tests so that 8-10 weddings can go off, beforehand. We're going to have to assess that. We're staying open on Saturdays so that when there's athletic events, or I think there is a wedding that I'm sure the party's going to come get tested this Saturday, we can be there for that. But us being the long-term solution to keep that industry open, I think we're probably going to need to find either a loosening of guidance or other partners to test.
Circling back to the mass vaccination clinic at Syracuse University, on Citrus TV, which is television
Yeah.
at SU. So having this mass vaccination clinic at SU, what do you hope that students can get out of this?
Well, if the students will all pre-register, then we will get it done, and we will get it done quickly. Right now, they can do probably 300, 400 shots a day with their infrastructure. We want to be able to come up and 10 times that, and we'll do that. I think right now it's about capturing the data and making sure that we aren't disrupting our infrastructure, which costs a lot of money each day, to go there and then only have a couple hundred appointments. So I think that's what we're trying to work through, but we would love to do one. Certainly we want the students to get their lives back once they have their immunity and enjoy the rest of their semester.
Just back on testing, do you get your supplies still from the state? Is that a sort of no?
No. So we purchased 30,000 test kits ourselves, I think, last week. So I don't know where the state, all that testing money they got from their stimulus, I don't know where it went. They haven't shared it with us yet, but we'll continue to purchase the tests so our program doesn't suffer. Our programs helped us. If you look at even this last wave, you look at what all of our peers, we still outpaced all of our peers, all the other counties. When you look at Western New York, went through another wave. Finger Lakes, to a smaller degree, we didn't really get one. We got a little uptick, but I think that we have testing there, and we're finding this virus, and before it becomes a real problem. And Syracuse University, their testing infrastructure they found the virus before it became a huge problem. And then so the testing is the tool to manage this, and it gives you an idea where to attack. Obviously, the vaccine is the cure to end this all.
And are those still the Bionx tests?
Yep. Yeah. So we bought the Bionx kits. Yeah. Yep.
What does 30,000 of those cost?
It's probably at least $150,000. Yeah. Other questions?
Ryan, today's April 12th. On May 12th, how many more first shots would you like to see? Obviously, 100% would be great. But realistically,
Yeah.
It seems that the more we open it up, the more groups of people you find that maybe not all fully want to have
Yeah.
it. So ideally, a month from now, what are our shot numbers look like?
So I think we're at 460,000 people. So we got to get to 462, 465, whatever number you believe. Right now we're at 360,000 adults. We have to get to about 270 to really, I think, hit the herd immunity factor there, and that should probably carry through for the community at large. The little kids get it from mom and dad more than they do from their peers, but I think once you have that 12 to 15-year-old demographic opened up, and if we can get even less participation, even if it's not 70 out of that demographic because parents are nervous, I think we'll go a long ways. So, but again, we always thought, you get to 300, somewhere between 300 and 350. total, that would leave us in a pretty good spot where we should see this thing kind of really be on the retreat.
You mentioned before that you're still in the works with Syracuse University to open up the clinic for vaccinations. When do you hope that this vaccination will be open?
Yeah, it's really about them and the data. So we'll meet, we'll help any way we can. Again, we'll give them more vaccine this week. But if you only say you have 1,000 kids that still need shots and there's the only ones that want, you can do that just with your regular workers for over 3 days, right? So it doesn't make sense to have a mass site. But if the new rule that they have triggers 4,000 or 5,000 other kids, now they're saying, all right, I'll go get it now, then we come on in. So it really depends on what kind of new demand there is on campus for us to really involve us taking 40 employees and moving them around, because I still have to have employees here doing second shots. So we'll do it if the demand's there, but they really need to tell us if the demand's there or not. Anything else? Okay. Thank you, everybody.